My name is Roman. I'll be doing medication administration today. My videographer is Cami, and my evaluator is going to be Bridget. So first we have the provider's orders, and then I'm going to check against the MAR, my hand hygiene. So let's see, we have the MAR for Mr. Wheeler. He's allergic to codeine. The medication that's listed here is digoxin, 250 micrograms, PO, or by mouth, once daily. And his heart rate has to be greater than 60 beats a minute. Vitamin B12, 1,000 micrograms via intramuscular, and that's going to be just now. And Levemir, which is insulin, to be 10 units subcutaneously once daily. So, and then now I'm going to go ahead and check over the medication, just make sure it's so let's see, we have digoxin here. Expiration date is 2037, so it's within the expiration. This is going to be in milligrams, so converting 250 micrograms to milligrams will be 0.25 milligrams, which is correct. And I'll make sure and check his heart rate before going into taking the medication, as well as swallowing. Next is going to be vitamin B12. So 1,000 micrograms is for 1 milliliter. Its expiration date is 12/20/30, and then that's going to be correct with what's here. And then it's going to be intramuscular, and it's going to be just now. So set those aside. And then last is going to be his insulin. This is expiration date 12/20/30, and then it's going to be 10 units of this. So it's going to be 1 to 1, so it's going to be 10 units subcutaneously once daily, which is all correct. So now before entering the room, I'll go ahead and check it one more time, make sure I have all my supplies and everything set up, and it's good to go. So digoxin, 0.25 milligrams by mouth once daily for Mr. Wheeler, who's allergic to codeine. His heart rate's going to be greater than 60, so I'll have to make sure and assess for that and his swallowing ability. Then I'm going to go and check out the B12. So B12, 1,000 micrograms per milliliter, which is what is requested via intramuscular, and it's going to be once. So for right now. And then lastly, we have the insulin, which is Levemir, 10 units, and then the expiration date is 2030, so it's within date, subcutaneously, and it's going to be once daily, which we'll do right now. So now I'm going to go ahead and enter the room. Provide some privacy. Alright. Hey there. My name is Roman. I'll be your student nurse this evening. If you can go ahead and tell me your name and date of birth. Alright, James Wheeler. And then date of birth. And then that matches with the MAR. And then can you tell me what you're allergic to? Codeine, anything else? Great. So today I'm going to go ahead and give you a few medications. It's going to be the digoxin for your CHF. Then I'm also going to give you a B12 shot intramuscularly, and then I'm also going to give you Levemir, which is your insulin subcutaneously, so we're going to do that one as well. How's your swallowing today? Having any issues swallowing? No? Okay. So I'm going to go ahead and also assess you for your heart rate, just to make sure that I can give you the digoxin. Alright, so your heart rate is at 82, which means I can give you your digoxin, so it's above 60. So now I'm going to go ahead and remake sure before providing the medication. So digoxin, 0.25 milligrams, which is equal to 250 micrograms. I'm going to give it to him by mouth once daily because his heart rate is greater than 60 for Mr. Wheeler, who is also allergic to codeine. Alright, and if you just swallow that for me, great, and here's your water. Awesome. If you can just open your mouth, say ah, great. So you swallow the medication. So this medication may cause nausea, vomiting, but it's supposed to help with your dysrhythmia and your CHF, so let me know if you're having any issues with that. So next we're gonna move into B12, or excuse me, we're gonna move into your insulin. So, where was the last place that you received your insulin? On your left side? On your abdomen on your left side? Okay, we're gonna do it on the right side today, is that okay? Great. So I'm gonna go ahead and clean the top of the medication and also check it. So we have Levemir for Mr. Wheeler, who's also allergic to codeine, 10 units subcutaneously, once daily, and the expiration date is correct on this 12/20/30. I'm gonna go ahead and clean the top. Like I said, it's gonna be 10 units. So I'm gonna go ahead and draw 10 units. Insulin.
Sorry, I feel like I was going to this a little bit. It was honestly. Did I miss anything? I almost missed explaining the varicella. Okay, pharmacy.
Alright, so this is a high risk drug, so I'm gonna go ahead and ask a fellow RN. What do I have?
10 units of Levemir.
Great. So I have 10 units of Levemir subcutaneously. So I'm gonna go ahead and clean the insertion spot. So you could just lift this up here. And I'm gonna go about 2 inches from the umbilical, so about right there. So I'm gonna go circular, more space there. Great. So I'm gonna go ahead and pinch the site, inject, and it's about 1 milliliter, so 1, 2, 5, and then hold it for 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So I'll go ahead and hold that there. I'm also gonna try and do some. Alright, and hold right up. Great, so that was supposed to help with your glucose regulation, so you let me know if you're having any signs and symptoms of hypoglycemia. You know if you need to eat anything, so that way we can help combat that. Alright, so last we're going to go ahead and do a B12 shot. This is going to be for your erythropoietin, because I think your red blood cells are a little low, so that'll help with that. So I'm going to go ahead and check the medication here. So we have B12, 1,000 micrograms, 1 mil, which is what it's asking here for intramuscular. So it's going to be 12/20/30 is the expiration date, so it's within the date. And then I went ahead and chose syringe as well. So it's just a 3 milliliter syringe, and then I'm going to use a blunt tip to draw up.
Next medication is going to be another nurse check and verify that it's appropriate because.
And so we need 1 mil.
So I'm going to lay the patient's decline and then I'm going to.
So I already drawn up some hair. So I'm going to insert some hair into the chamber. Giant ear bubbles. Draw back 1 mil. is gonna be an intramuscular injection. I'm gonna go ahead and place this into your ventral gluteal region on your left side. So I chose a 23 gauge 1 1/4 because it's an injection. Go ahead and clean your site.
Hi, I'm Becca. I'm going to be administering meds today. Haley is my videographer and Alexis is my evaluator. So I'm going to go ahead and start with the provider's orders. The patient is Jamie Wheeler. He was
Alright, so find the dorsal ventral gluteal region. I'm gonna palm my hand on the greater trochanter, and then I'm gonna put my thumb facing the umbilicus, pointer finger on the anterior superior iliac spine, and then my middle finger on the iliac crest. So I'm gonna go ahead and clean the spot. So it's gonna be right there, right in the middle, 2 spots. So circular motion. Alright. And we see we got 1 milliliter here, so I'm gonna go ahead and try to track. So pull that area, and then 1, 2, 3, 4, 5, 6, 7, 8, 8.5, 9, 10. And then I'm gonna hold it for 10. So 1, 2, 3, 5, 6, 7, 8, 9, 10. That, and stop the bleeding. Great. Go ahead and clean up my site and put the dirty needle. Alright, so there shouldn't be any pain or discomfort from that. There's usually no signs or symptoms from that one, so it should be just possibly a little pain in the area, but nothing too notable from that. So let me know if you have any other issues with that. So I'm going to go ahead and assess my patient to make sure that there was no signs of anaphylaxis. Make sure that there's no redness, or any other issues in that area throughout the body systemically, and then from there I'm going to go ahead and make sure that he's in a position of comfort before leaving. Leave all nice and comfortable. Alright, great. And then I'm going to go ahead and document the medication used. So we used digoxin 250 micrograms by mouth once today. It was at 82 beats per minute, so I'm going to go ahead and make sure and put that in there. And then also give that medication at 3 p.m. So I'll make sure and mark the time that was given and see, next I gave the insulin, 10 units subcutaneously on the right abdomen. And that was done at about 3:02. And then we also did a intramuscular injection on the ventral gluteal site on the left side, 1,000 micrograms intramuscularly, and that was at 3:05. Yeah, I suspect that the patient will have glucose control, that the B12 shot should help with red blood cell count, and that the digoxin should help with contraction of heart and better regulate the patient's CHF.